Everyone, afternoon. Pleasure to talk to you today about what the pandemic has done to employee health and wellbeing. Good to see some former colleagues and friends in the audience as well. No heckling from you guys, please. My name's Justin. I am Head of Physiology and Clinical Development Lead at Nuffield Health. I've been working in the health and wellbeing industry for about 15 years, and my role in Nuffield is really looking after the quality, safety, and outcomes of our health assessment service. We do around 80,000 health assessments a year, but I also get involved in our own employee wellbeing stuff as well, which is a real passion of mine. So, quick show of hands. Hands up if your organisation has a workplace pension scheme. Might sound like a little bit, oh look, pretty much everyone. Interesting. I often ask this concept to kind of throw it out there because we can't really imagine life without one, can we? It's mandated. At 22, you start paying into a pension scheme, and it doesn't really make sense to get to, say, 60 and go all of a sudden, actually, I better start thinking about my retirement. It just strikes me as alarming that we don't do the same with wellbeing. Wellbeing is still not mandated at the moment. Organisations don't have to do anything with it. Legally, we have to do something with health and safety. Wellbeing seems to be a nice to have, and unfortunately, often it's just shoehorned into someone's job title. Say, oh, you've got a Fitbit, do you want to look after wellbeing? But I think the pandemic has changed it. We're now getting far more au fait with the importance of wellbeing now and employee wellbeing, and looking after it is the right thing to do rather than going to the organisation, I need some money for wellbeing. They go, what's our ROI? What are we going to get back from that? But no one ever does it with pensions. By the time you're giving someone a pension scheme, they've gone. They're 65, 70. They're never going back to your company. You're not making any return on that, but you do it because it's the right thing to do. Just something to think about as we go through this presentation. So COVID has actually had a big impact on the wellbeing of all of us. And because we've got 30 million employees in the UK, it's had a big impact on employee wellbeing. It's actually just magnified the health inequalities that already existed. So from a health perspective, men were actually at bigger risk of dying with COVID. The initial Public Health England study found that working age men were twice as likely to die with COVID than working age women. We know that the BAME community has been disproportionately affected, and probably because both men and certain ethnicities struggle with comorbidities, hypertension, diabetes, heart disease, which we know have a massive impact. Musculoskeletal conditions went up during the pandemic as well, but for the first time we started to see a massive rise in neck and shoulder pain rather than lower back pain as being the predominant reason why people were having issues with musculoskeletal health. Behaviourally, for some people, the pandemic was great. I was out running every day. It's amazing what a catalyst that can be. You're only allowed out to exercise. All of a sudden, everyone's out running, everyone's out walking. But actually, as many people who are out doing more exercise, the same number of people, around a third, were actually doing less exercise due to shielding, or perhaps their main source of activity might have been walking to work. They're not going to work anymore. Sedentary behaviour, therefore, increased. So gone are 10,000 steps a day. I'll be lucky if I get 1,000 in when I'm working from home, and I'm sure many of you will appreciate the effects of that. Alcohol-specific deaths are up 20% from 2019 to 2020. Now, I'm not saying that the pandemic caused that, because alcohol-related deaths actually take a long time to kill someone, but the help that was available, AA and GP support and other supportive networks, weren't there. People felt this wasn't their cause, it wasn't their issue. There's research showing that 50% of cancer symptoms went undiagnosed because people thought, actually, I'm not going to bother my GP, that lump, it'd probably be nothing. Whereas in the past, they would have perhaps done something with it. So alcohol-specific deaths did go up, but probably as a result of a reduction in people accessing services. Some people drank less. So, if your main source of drinking was pubs and clubs and that kind of thing, guess what? You drank less. But if, like me, you've definitely settled into kind of family life and your main source of alcohol is a glass of red with an evening meal, well, guess what? If you don't have to get up and drive in the morning and you're working from home and you can just turn your camera off, those people ended up drinking a little bit more. So the people who were already drinking lots drank lots and lots, and that's where that inequality came from. And then we ended up with this thing, coronasomnia. So people slept less and they had poorer quality sleep. And there's a really obvious reason for that. If you start blurring the lines between home life and work life, your body won't let you sleep. Part of the reason why we don't drop into deep sleep and stay there all night, because through Darwinianism, you would die out if that was the case. You try waking someone from a deep sleep, it's really tough. So if you're out sleeping, I'm not going too primitive, but if you're out sleeping in a cave and you're in a deep sleep, someone could creep up on you, attack you, whatever it may be. So your body, during times of anxiety, when it thinks something is around that's a threat, it will keep you in that light sleep. So you might be getting 8 hours, but you're going to wake up feeling exhausted. And then you're going to wake up hungry, you're going to reach for a coffee, maybe a bacon sandwich. You're not going to want to exercise because we know that leptin levels start to change when we have poor sleep. So spontaneous physical activity starts to reduce. And all of a sudden, that's a perpetual cycle. You're not sleeping, you're not exercising, so you're tired, then you drink caffeine, and it just goes round and round. And then ongoing, long COVID, big issue. So we know that with COVID deaths, the majority of deaths are actually above average life expectancy for most males. So most males can only expect to live to about 79 in the UK. Most COVID deaths are in people who are in their 80s. But long COVID is affecting people of all ages. And as a result, it's affecting employees also. We know that the symptoms of this include fatigue, joint and muscle pains. Domestic abuse is up. So believe it or not, for some people, the office is a bit of sanctuary. They get out of the house. The home isn't always this kind of happy haven we expect it to be. And the NHS have estimated that 10 million people will need additional mental health support as a result of COVID. So that's just kind of painting the picture. So what happened was one of the biggest changes that we changed our relationship with the office. So we went from around 5% of people working from home on a regular basis up to 50% in next to no time. Now, remember, it was supposed to be 3 weeks to flatten the curve, right? Do you remember that? So we thought, it's going to be a 3-week holiday working from home, then we'll be back in the office. So we expected this very kind of sharp reduction back down to somewhere near normal levels. Then when we realized 3 weeks was actually a long time, and actually it was more like 3 months, 6 months, 9 months, people thought the office was dead. And we're expecting no one's ever going to go back to the office. And actually the reality is, according to some research by the CIPD, is that we'll end up somewhere in the middle. And that around 1 in 4 or 1 in 5 people will regularly work from home moving forward. So we're not going to go back down to the levels we're at, but the office is still very much alive. But it's probably part of a wider working ecosystem rather than somewhere where we go to work. Now, there are some benefits to people working from home. One is their well-being. So people self-report better well-being when they work from home. They have better opportunities. They have more job satisfaction. The commute drops, which is great. I mean, at the moment, with all of the things which have been going on around the M25 over the last few weeks, people are starting to think about their carbon footprint. Well, if people aren't having to drive into work and get the train into work and that kind of thing, definitely a benefit for not just organisations, but people as well. It's cheaper, but actually it's cheaper to the environment also. Time is a big thing. People can be more productive, and we'll talk about solutions a little bit later, but if you don't have to commute, my normal commute to work is about 2 hours each way. So I can be more productive with that time if I choose to be. Turnover intention is reduced, so people are less likely to want to leave your organisation if you allow them to do some hybrid working or remote working. And productivity increases, but there's a grey area here. They say productivity increases, but not many people actually measure productivity. Not many organisations actually put a pound and pence figures, but people tell us they're more productive. We've done research on this, so there's a white paper out there that we published before the pandemic. I wouldn't say that we were predicting this, but we recognised that the office was changing and that people were doing more remote working, so please do look that up. But what we found was that the hybrid model is better and around a 3-to-2 or 2-to-3 ratio. If you tell people they must work from home, that affects their well-being negatively. And if you tell people they must go to the office, again, that tends to affect their well-being negatively also. Now, interestingly, employee absence is one of the main things that people start to measure, but employee absence has been going down for 25 years. We've never had a more present workforce. And whilst it's been going down for everyone, we know that people with long-term health conditions are 4 times more likely to be absent from work than people without them. The challenge we've got is that if you've got remote workers, it's very difficult to see if they're absent. People can pull a sickie and just not turn up to certain meetings. And that becomes really challenging. Because all of a sudden, how do you start to measure the impact of your productivity? We have never had more jackets on the chair. And what we see is that during times of economic uncertainty, happened in 2008, credit crunch, happened with Brexit, it's happening now with the COVID pandemic, is that people are even less likely to take time off work sick. And we know that impacts productivity. The main causes of absence are mental health, musculoskeletal issues, stress, and acute medical conditions. And guess who has them more? Unfortunately, older people. So this is data from our health assessments, and what we recognise is that for the main risk factors of acute medical conditions, musculoskeletal issues, and mental well-being issues, they generally get worse as you get older, apart from mental well-being, which tends to get better as we get older. But older workers are more susceptible to having time off work sick because of these things. They're more likely to be obese, more likely to have high blood pressure, and as a result, acute medical conditions, musculoskeletal issues, etc. Now, the interesting thing is that that's just the tip of the iceberg. What you need to look at is presenteeism, and that's this thing about productivity that I mentioned. If you're only measuring absence, you're really missing the trick, because presenteeism shows that we are far more likely to actually suffer costs as a business if people turn up to work sick but are not fully there. Now, the presenteeism risk, whilst you're more likely to take time off work sick as you get older, actually, for presenteeism, it's things like being physically inactive, alcohol, sleep, things which affect everyone. And our data shows that we don't have this thing where lifestyle factors get worse as you get older. Actually, it's a bit all over the place. So you're less likely to be sedentary as you get older, but you're also less likely to exercise. But you're less likely to smoke, but you're more likely to drink. So when we're looking at productivity and presenteeism, it becomes a far more blurred picture. Now, the individual challenges with working from home, as I mentioned earlier, physical activity is a big one. People are far less active. And we have something called NEAT, non-exercise activity thermogenesis. Guess what? You burn more calories just walking around, fidgeting, going to the train station, up and down the stairs to the next meeting than you do during your normal gym session. So people getting up and being active is really, really important. Musculoskeletal health is a massive issue. Anyone done a DSE assessment and, you've got to set your desk up here and you've got a screen adjuster and a back support? All of a sudden, we went to people, go work from home and here's a cushion. And again, we thought it was 3 weeks, so we didn't bother giving them laptops and chairs and desks, but it turned into a year. And it's going to continue. So what are you doing from a resource perspective to support people? I've mentioned about sleep health. So the Royal Society of Public Health did some research into this and found that everyone who worked from home generally had poorer sleep, but you are more likely to have poor sleep if you work from the sofa or the bedroom than you will do if you work from a dedicated desk, even if that desk is something like a kitchen table or something like that. Again, the body needs to break up that link between work life and home life, because otherwise it struggles to compartmentalize things, and as a result, you end up feeling anxious at home when you should be relaxing and unwinding. People who do like bedmin, get a laptop out in bed, that is the worst. You will never sleep well with that. Mental health issues. So as I said, for some people, working from home isn't always a good thing. They've got family problems. I've got a Labrador that it drives me insane. We call him Wreck-It Ralph. And Ralph is on every conference call I'm on in the background, kind of chewing something and destroying the house. So again, I don't feel particularly relaxed when I'm working from home. So we've got to consider this. Also, a lot of your employees might be in house shares. Well, imagine 5 or 6 people all working from a shared lounge. It can be really, really tough. Connectedness. Younger employees really struggle to connect, and particularly if they're new into their workplace. So consider who you're going to make work from home. ACAS have got a really good model out there. They show that generally the people who work well from home are highly resilient people. People who are generally over 40 because they've got experience of having worked from home in the past, and people who have no blurred lines, so you know what your job is, and no one's stepping on your toes. There's nothing worse than kind of swim lanes when people getting in your swim lane when you're not actually working around a table together. And as I've mentioned, switching off. So in Europe, particularly in France, they have something called the right to disconnect, where you're not actually allowed to send any emails outside of working hours. Our medical director does something really, really good, where at the bottom of her email signature, she'll just say, I've sent this email at this time because it works for me. I don't expect you to respond until you get back to work, which is great, because she'll send me emails at like 11 o'clock at night, but it works for her. And that flexible hybrid model is going to become more and more important. So what can you guys do to mitigate the risks? Well, first of all, think about wellbeing equity. We're very, very good at doing things like health assessments. As I mentioned, Nuffield do loads of them. But I go into organisations and often they'll say, when you're 40, you can have a health assessment. Or when you get this important, you can have a health assessment. As I've shown earlier, the pipeline risk factors are developing for years, if not decades. You don't get hypertension because you've been on stag doing Nuki over the weekend. You get it because you've not been eating right or drinking right or moving enough for 5, 10, 15 years. So if you're looking at wellbeing solutions, try to think how they can be equitable for everyone. So think about that wellbeing pension fund. It's no good getting to 60 and going, oh, I better start tucking some money away now. Use the data that you get from them to drive your decisions. As I've just shown you some of the data, you can then start to target which parts of the business, be it different divisions, different age groups, different genders, are actually most at risk for different things. Identify long-term health conditions. As I've shown you, absence rates are going down, sure. But you are 4 times more likely to be absent from work if you've got a long-term health condition. So when you identify them, support people to manage them. Give people the right tools for the job. If you're expecting people to work from home, think about the desks. Think about the screens. Think about time where people can actually schedule in coffee breaks, exercise or something like that. Job design, so actually write things into people's job spec, job description. Let them know what the expectation is for them. And consider who you're hiring. People do need to be resilient if they're going to work from home. They do need to be able to switch off. They do need to be able to make their own decisions. But they also need to feel connected. And that's the final one, supportive culture. I feel that often people end up being line managers because they're good at their job, not because they're good with people. So what can you do to help people and support people? And then finally, it's important to contribute to that wellbeing pension fund. Trying to save money when you get into debt is a little bit counterintuitive. This is the illness-wellness continuum. And in the UK, we basically only start to do something when we identify signs and symptoms of disease. Hence, you can have a health assessment when you're 40. What can we do to build up to higher levels of wellness? Meet our expert events, health literacy, engagement. Try to get people to understand that you need to pay into this, because guess what happens when you retire? Not only does your income decline, but usually your physical and mental health decline as well. And if you haven't paid in enough to both over the course of your career, they can decline quite quickly. So, any questions?
Well, I think we've just about got time for one question.
Oh.
It's going to have to be a fairly snappy one. So I think we've got the perfect question here in what one thing would you say employers can do to start mitigating some of these health factors now?
I think get your people moving. There's a brilliant publication called Exercise the Miracle Cure and a doctor's role in promoting it. It shows that if you just do 150 minutes of exercise a week, you can lower your risk of depression by 1/3. You can lower your risk of back pain by about 40%. You can lower your risk of heart disease by about 40% again. So actually, all the things that are the driving risk factors for presenteeism and absenteeism, if you get people moving straight away, those things start to mitigate. And finally, just if people are working from home, encourage them to commute from the door to the door. It's a great way for them to use that time they would have been doing, driving, getting on the train or whatever it is, but it just keeps that cycle in. And actually, just like your pension fund, we all know paydays at the start of the month, right? There's no point trying to save halfway through the month. So get people to exercise first thing in the morning. Then no matter what happens during their working day, they've already banked that into their pension fund, as it were.
Justin, thank you very, very much.
Thank you.
Today. That's been fantastic.
Very much.